The next patient to visit the Embarrassing Bodies clinic is 23-year-old Alison, who has a condition that she's desperate to get off her chest.
I've had it since birth. Only really started to notice it now I've become a woman and, I want to sort of wear low-cut tops and be a bit more sexy, I suppose. But I don't.
What can I do for you?
Well, I have a condition on my chest which causes my chest bone to cave in, if you like.
Okay. And has anyone else in the family got it?
My father.
Your father has it. It is an inherited condition. It does tend to run in families. In fact, it's the most common one that there is. So, you're common, I'm afraid.
Oh,
it's good to be common because it means we know what to do about it. Okay, so yeah, it's noticeable here, isn't it?
Yeah.
Just have a feel of your chest wall, first of all. I'll be quite honest with you. When I've seen it before, it's mainly been in boys, and it's very, very, very obvious.
Yeah.
Because you're a woman, and if I may say so, you've got good boobs. Your boobs cover it up quite nicely.
As Dr. Christian says, Alison's unusual, as funnel chest is far more prominent in men than women. It's thought that there are 8 times more male cases and as many as 1 in 400 people affected by the condition.
One of the things it can do is displace your heart to one side or the other. So, what I want to do is send you off for some further tests. Get your heart and your lung function checked out, make sure they're fine before we make any big decisions. Would that be alright with you?
Yeah.
Because funnel chest can affect cardiac and respiratory function, the first stop for Alison is to x-ray her heart and lungs for signs that the condition is causing any adverse problems.
And hold your breath.
The results from these tests are crucial and will affect her options for corrective surgery. We'll be catching up with Alison later to see if her dream of having a less depressed chest comes true. Earlier on we met Alison, whose sunken chest was getting her down. But before any surgery could be considered, Alison's heart and lungs needed to be checked for any abnormalities. Fortunately, the x-rays showed that her heart and lungs are perfectly normal, which means she can avoid the grim prospect of major surgery. She's now about to meet a specialist consultant to find out what her options are.
Really excited about seeing the doctor today, but also quite nervous about what he might, advise me to do. But mainly excited because obviously we're on the verge of getting it sorted out now.
So just how bad does her consultant, Mr. Dalvi Humzah, think Alison's funnel chest is?
In Alison's case, this is not quite so extreme. The most extreme case of pectus excavatum is when it goes in quite deep into the chest and can cause breathing defects.
Dr. Humzah is going to use a cosmetic filler called Macrolane that will last between 18 and 24 months. This will recontour Alison's chest shape with less of a depression. So, a few weeks later on, is Alison impressed with her new chest?
How did you find it?
Harrowing, to be honest.
Really?
I struggled with the surgery, yeah. It wasn't the most pleasant experience.
And are you happy with the results?
It's okay.
You're not delighted, are you? I can
No.
tell immediately. Tell me why not.
Well, because it hasn't filled out as much as I would have liked, that's all.
Do you still think there's a big difference? Do you still think there's an obvious hole there?
Yeah. But like you said before, I'm looking down so I can see exactly that. But
I mean, as I think I said to you the first time I saw you, I didn't think it was the worst case of pectus excavatum I've ever seen, but the fact that it was distressing you was enough to suggest to you that there are treatments we can do. You've now tried them. How do you feel about the condition now?
I still hate it.
You still hate it?
Yeah.
I would give it a bit more time, sort of get over your ordeal and rethink about how you feel about the condition. And of course, this is not the end of the road. There's still other things you can do.
Yeah,
Yeah?
definitely.